Hi, it's Susan Nicely, and welcome to today's episode of I Travel Nurse TV. Nice to see ya. Today's episode is on the travel nurse company, Supplemental Healthcare, travel nurse companies in review. Now, Supplemental Healthcare is a big travel nurse company. They have their headquarters is located in Utah, and they have bigger offices in certain parts of the country, one being Buffalo, and then they have satellite offices all throughout the United States. Now that makes it a very attractive company for any nurse to want to work for, based on the fact that a big company usually exhibits the presence of stability. And there's always a situation in which a travel nurse could potentially not get paid. Travel nurse or agency staff nurse could not get paid. There's always that potential. So the fact that Supplemental Healthcare is so big, also the perception is that they are financially sound. So that is a big plus for Supplemental Healthcare in general. Now, Supplemental Healthcare, through both their travel division and their local field offices, they have a lot of contracts with many, many different hospital systems, the big guys, the little guys, everybody in between. So if you are looking for a travel contract anywhere in the 50 states, you are definitely going to find something with Supplemental Healthcare, and that is also very good. It's really hard when you have to start scouting different travel companies to try to see if they have contracts in a location where you want to go. And then when you can't find it and you have to change companies and you have to do all the paperwork again, that causes a lot of, grief for us in the industry, a lot of extra work that you shouldn't have to do per se, if the fact that the company that you're currently with had a contract in many different parts of the country. So that is a plus for Supplemental Healthcare. The problem that I see with the company is their organizational structure and how they handle commission structures and assignments within their recruiters. And so by the way they do it, it ultimately can affect how you, a travel nurse, can get a job. Now, let me give you an example on this. So I signed up and contacted Supplemental Healthcare wanting to do travel nursing. And I've also contacted one of their local offices down in Houston, Texas to do work down there. I could do like per diem agency staffing, or I could do travel contracts. But they seem to want to lock up their contracts with certain offices, and which doesn't allow you the flexibility to change offices or change recruiters easily, especially if one office or one company is not doing their job. Now, Buffalo, New York is a prime example of where things can go south as far as you getting a travel contract. Now, here's been my experience with Supplemental Healthcare. First of all, their travel division out of Buffalo, New York is extremely slow. So, we're quick, we're good. And, we have all of our stuff usually together, all of our documents. We do that testing all the time. We have our resumes ready to go. I mean, we're on the move, especially, it's just based on the kind of work that we do. I mean, we move quickly. And people like me that are also ER nurses, we probably move extra quick and then even other nurses, just because we're like always in ER mode. Okay, so we can get stuff done really quick. Now, their Buffalo office is extremely slow when it comes to submitting for contracts. I experienced that when I was down in Dallas, Texas. It seemed to take them forever to submit me to assignments that I knew there were needs at that specific hospital. I mean, I was right down there in downtown Dallas. I mean, and there's, Park Hospital, which is a huge medical center, and then there's UT Southwestern, and there's just a ton of hospitals in Dallas, Texas. And you know, I even told one Houston police officer, I'm like, look at all, or no, I'm sorry, not Houston, Dallas police officer. I'm like, look at all these hospitals here, Dallas PD, and I can't even get a job? What the heck is going on? I mean, heck, even one of a Dallas PD officer, it was even showing me around the campus of their hospital center, you know, and I'm just like, God, geez, you know, it took me forever to get supplemental health care to even submit me for a contract. So then, you know, I had an interview with UT Southwestern for their emergency room, but, you know, I needed a job, you know, there were just so many delays and I needed a job quick. And, you know, I mean, I was just really cutting into my savings here. So, but I had an interview with UT Southwestern with the manager. And then I kept getting on my recruiter up in Buffalo, New York named Stuart. And I kept saying, I need you to call. I need you to figure out if I've got an offer or not. I need you to figure out today if I've got an offer tonight, you know, or not. I've got to make plans. I've had other interviews in other parts of the country. You know, I need you to find out today if I've got this offer. If not, I got to take something else and I got to move on. Well, you know, they were so slow on getting back to me that I actually took a travel contract with another company with integrated healthcare in Tuba City, Arizona, because supplemental healthcare was it took them like 3 or 4 days to confirm that I got an offer from UT Southwestern. So, you know, that's absolutely ridiculous. You know, you have an interview and usually you know that day. So why they are so slow is just absolutely beyond me. So that is not good for you, somebody that's coming in. Okay, and then I tried to work with one of their offices when I was down in Southern California in LA County. They have a satellite office down in Long Beach, California. So I actually went to their office and I signed up with their Long Beach office and did all of their paperwork and I did all of their testing and so forth. And then what happened is because the Long Beach office apparently holds some contracts, but because the Buffalo, New York was still holding me as a travel nurse up in Buffalo, New York, up in their office, the Long Beach office, by whatever policy that supplemental healthcare has, could not put me on a travel nurse contract in Southern California. I mean, apparently their account manager couldn't do that, and neither one of their recruiters couldn't do that either because I was assigned as a travel nurse in Buffalo. But now the Buffalo, New York office was taking no steps to get me a travel contract anywhere in Southern California. The Long Beach office was, but they were prohibited from doing so because of the Stewart and this Buffalo, New York office. So that was absolutely crazy that I couldn't start working right away on a contract that I could have got started on right away in Southern California, all based on how they've got their network set up. Now, then, so I wasn't able to do a travel contract. I could have done a nursing travel contract. Now, they do very, very little when it comes to nursing, this specific office in Long Beach. They usually do more of physical therapists and occupational therapists, and nursing was something that they were expanding into. I mean, they were able to get me like an agency shift. They were able to do that, but then, you know, because of all the stuff in Buffalo and everything, they were just really limited as far as what they could do for me as far as a contract. Now, moving forward on that, the Buffalo, New York office, after, I actually signed up with another nursing agency because of all this. I signed up with Core Med Staff, and I did just agency staffing for a while all over LA County based on this disaster. And then their Buffalo, New York office got me a contract in Riverside, California. And there was nothing wrong with the hospital. The hospital sounded great. The ER manager was totally cool. And the problem was with how supplemental healthcare was going to do housing. You know, they were going to end up renting me an apartment, but they weren't going to pay for utilities. They were just going to put me in an apartment with what? Like no heat, air conditioning, or electricity. Well, you cannot do that. In the industry, you cannot just put somebody in an apartment, pay for an apartment, and then not pay for the utilities to go in the apartment. You cannot do that. And I say, you know, that is so, not only is that so wrong, I think it's highly illegal for a company to do that. So something was just not right with that contract altogether with supplemental health care. So I pretty much told them to shove it. and I called back the vendor manager that was managing the contract through Supplemental Healthcare and through Riverside Hospital, and explained to the vendor manager that my problem was with Supplemental Healthcare, and that is why I'm not going to be able to take this contract rather than, rather than otherwise, because I would definitely like to come back to Riverside Hospital, have that opportunity again in the future. But I would just have to say a lot of it has to do, they are really, really jacked up. Supplemental Healthcare is. They're slow. They seem to be very, very controlling. They will come up with travelers having like unnecessary expenses or expenses that they would have to pay for out of pocket that were not told to them in advance, and just automatically just expect a travel nurse to have that ability to just fork over a bunch of money. Now, one of the reasons why we are traveling and going to these different cities and states and using a travel nurse company is so we get corporate backup when we go to these new locations. I mean, you cannot have a travel company put you in a different city or state that you're not familiar with and then just totally leave you to fend for yourself, and that was the type of thing that Supplemental Healthcare was trying to do, especially when it comes to paying for these utilities or arranging utilities and so forth. And they weren't being accommodating to the fact that I don't travel with a car. I either travel by plane, or I go Greyhound, or I go taxi, or I take subways, and I do all kinds of those kinds of stuff, and they weren't willing to make accommodations in housing arrangements either. So they're not a flexible company when it comes to housing arrangements. They're pretty much stuck to whatever crap that they give you. Now, that is something that other travel nurse companies don't do. They usually make accommodations based on the needs of the travel nurse, whether or not they have a pet, whether or not, they're using public transportation, or they have a car, or whatever the circumstances are. If they're traveling with a spouse, a boyfriend, kids even, they usually accommodate the travel nurse based on their needs. And Supplemental Healthcare was not willing to do that through their Buffalo, New York office. So, like I said, I would give Buffalo, New York, their travel nurse division, and Supplemental Healthcare in general, I would give them about a 60% as far as reliability when you take a contract with them or when you sign up with them. They do have a lot of contracts, so if you are in a position where you are looking to go many, many different places, it's definitely worth signing up with them, but just know that their follow-through will be extremely, extremely slow, and they could end up jacking you even after you get a contract and get a contract acceptance when you try to get to your destination. So that's today's episode of I Travel Nurse TV, Healthcare Companies and Review Supplemental Healthcare. Now, nurses, when you're out on the road, make sure you take your stun gun with you, stun gun, pepper spray. There's always bad guys that can come after people like us. Keep yourself safe with products from Damsel in Defense. So I will see you next time on I Travel Nurse TV. Hope you're enjoying your current assignment, and have a good one.